Welcome. My name is Denise Chamblee, and I'm a pediatric ophthalmologist. I'm looking forward to sharing with you a series of short presentations designed for ophthalmology staff members. This first one, How Staff Can Save Vision, describes a malpractice case that is one of the most common that we see at OMIC. So what I'm hoping to do today is to review with you a particular malpractice case and then review what went wrong and how we can do better. And in this series, we'll have the same outline for each of these next 4 cases. So again, this first case is something we see over and over and over again at OMIC. Patients with flashes and floaters are very, very common, and the patient often feels later when things don't turn out so well that their original symptoms weren't recognized as being a retinal detachment. So in this particular case was a 79-year-old gentleman. He had had cataract surgery about 3 months ago, and he saw his ophthalmologist this past week. Ophthalmologist said, "Hey, you look great. Everything is going perfectly. I'm so glad you're doing so well." But then a couple of days later, the patient had flashes and floaters. And he called the office, and the telephone operator said, "No problem, we're going to get you scheduled for next week." And the patient was a little bit confused because he said, I was told that if I had these symptoms, I really needed to call right away. So it seems a little funny to me that you're scheduling me for next week, but okay. And the operator said, I spoke to the doctor. There's no worries. It's fine for you to come in next week. Well, unfortunately, a couple of days before his scheduled appointment, the patient called back and he said, "I am coming in. I am angry. I'm upset. My vision is now bad." And he ended up with a retinal detachment, had surgery for his detachment, and unfortunately had a poor outcome. So I'd like to talk to you for a little bit about flashes and floaters in general. And these 4 questions we're going to talk about in detail, but I just want to introduce to you the things that we might be concerned about in this case. So first of all, how soon should a patient come in that has flashes and floaters? What if there's no doctors in the office that day and the patient needs an appointment? Well, what if the patient refuses to come in? And what did you document about your conversation with this patient and where? So first of all, how soon should a patient with flashes and floaters come in? We always need to know which problems are emergent, urgent, or routine. And whether you're answering the phone as a telephone operator, you're a technician taking a call, you work at the front desk, these are really, really important things for you to know. In fact, any symptom that a patient might report that's related to their visit with the ophthalmologist should be something that you should be comfortable with. So we have a telephone screening form on our OMIC website, and you're welcome to download it, and in fact, I'd encourage you to do so if you have not already. What you're seeing on the left is called our patient telephone screening form. And in this form, we see a bunch of questions that can help you to determine what the patient's problem is and therefore how urgent the patient needs an appointment. The form on the right is extremely helpful, and our telephone operators keep this by their desk at all times. And what this form does is it goes through the common reasons why a patient may complain, and it classifies those into emergent, urgent, and routine. In our office, we actually have all of our telephone operators and anyone who answers the phone review this on a yearly basis, and then we document in the staff's chart that they've reviewed this, they're clear about these symptoms, and they're comfortable with how to screen these patients of when they need to come in for an appointment. So in this case, what happened? Well, the telephone screening didn't go as well as we would have hoped. The symptoms that the patient complained of, the flashes and floaters, weren't recognized as urgent. And in addition to that, the telephone operator and the doctor, nobody recorded any kind of documentation of the call. So what happens a lot of times with malpractice claims is that the incident, the thing that happened that led to the claim, can occur, and it may be 2 or 3 years later as to when the claim comes, and at that point, nobody remembers what happened unless, of course, they documented it. So what if there are no doctors available in the office that day? What if you don't know who the patient should be seeing? Especially when a patient has urgent or emergent symptoms, we have often seen in other claims answers like the following. Okay, all the doctors are out at a conference today. I'm so sorry, but we won't be able to schedule an appointment. Or we've heard, well, we no longer accept your insurance, so we're not going to be able to schedule you an appointment. These are things we really don't want to say to the patient, not just because of a malpractice claim, but because we want to take good care of a patient. And if we know they have urgent symptoms, we want to make sure that they're seen in a timely manner. So if a doctor is unavailable to see the patient, one thing that's extremely important, of course, is that you have an office policy as to what to do with that patient. Again, you want to make sure that they have the best care possible. So whether that's that the patient sees the doctor on call, or they're referred to the emergency room, or maybe they're even referred to a doctor that's not in your office that's covering for these emergency patients, you want to have it clear in your mind as to what you can do with this patient that needs to have an appointment soon. So what if a patient actually refuses to come in? In these days, we have high copays, high deductibles, and sometimes patients really don't want to come in because they don't want to pay those copays or deductibles. Sometimes they don't have transportation, and so they refuse to come in. So in those cases, obviously, this is a time when you want to speak to the doctor and be very, very careful about documenting your conversation with the patient. So in this particular case, the operator said to the patient, not to worry, I spoke to the doctor. At least that's what the patient said. The operator said, oh, well, I would have never said not to worry for a flashes and floaters patient. And the doctor said, oh, well, I would have never told a patient that they can wait till next week with flashes and floaters. So again, your documentation, since you're not going to remember this a couple of years later or a few months later when the claim comes, it's really important that you document your conversation with the patient. So how did your actions affect this patient? Obviously, you want to be familiar with our telephone protocol, what questions are necessary to ask the patient in order to figure out when they might need to be seen. Also, obviously, you want to be familiar with which symptoms need to have urgent or emergent care. Of course, you want to have an office policy so that you are very clear as to what to do with the patient that needs to have care that day or maybe the next day, and there's no doctor available. Again, documentation is extremely important because you don't want to get into some sort of he said, she said. You want to be clear about what your conversation was with the patient and their need for urgent or emergent care. So how do each of you contribute to saving a patient's vision? Obviously, you want to be able to recognize the symptoms and know how important they are. You have the ability to take care of the patient and get them timely care and appropriate care. And finally, you have the ability and the need to document what your conversation was with the patient. At OMIC, we're always happy to answer your questions. We want the best care for the patient. Please feel free to contact us at riskmanagement@omic.com, and we're happy to help.